Assalamu alaikum rahmatullah. Here Iman Majid. I am medical laboratory technologist, biochemistry. I hold MTASCP, HAD and DHA, also master degree. My email is imanof@hotmail.com, EIMANOFE@hotmail.com, and I am a job seeker. Today I will talk you about the most important question that you may be asked about when you go to an interview for those who are laboratory professionals. So I will introduce the question randomly so you can organize it into your own organization. The first important common question in the interviews is introduce yourself. All the interviews in the hospitals and medical centers and the big laboratories are directed by laboratory supervisor. So the laboratory supervisor may introduce himself and ask you to introduce yourself too. So you can introduce yourself by your name and your professional title and your experience and now what you are doing. Okay, for me I can say I am Iman Majid and I am medical laboratory technologist, specialty biochemistry. I am graduated in 2010 from Khartoum University, and after graduation immediately I have just opened my own laboratory. It is Al Shifa laboratory, and I was the general manager for that laboratory, and I stayed in that position for more than 4 years, and unfortunately I have to close it, so I closed it for personal problem, and now I am not employed and I am a job seeker and looking for a job and really ready to move and relocate. So by that introduction you can show the lab supervisor what you were and what you are now, or what you are willing to do now. And there is also common question are what tests are done in the laboratory, or the routine tests that you can do in the biochemistry laboratory, in the hematology, microbiology or histopathology or etc. You can say in the biochemistry laboratory we do mainly the RFT, renal function test, which contain urea, creatinine, uric acid and glucose, and there is also LFT, liver function test. It's contain protein, albumin, bilirubin, direct and indirect, electrolytes, calcium, magnesium and phosphorus. Electrolytes which contain calcium, magnesium and phosphorus. And in cardiac profile we do mainly troponin, CKMB, AST, LDH, and in enzyme we can do GGT, amylase, AST, LT, PK, acid phosphatase, prosthetic or total. And in lipid profile we have total cholesterol, which include LDL, HDL, triglyceride. And in bone profile we have calcium, albumin, phosphate, magnesium and ALP. And also he can ask you about which routine test or the hematologist test. Okay, you can say we can run CBC, PT, PTT, bleeding time, prothrombin time, this is for coagulation, and retics count, blood grouping result, this is for blood banking. There is differential count, ESR, fibrinogen degradation product, cycling test, factors assays like factor 7, 8, 9 and 11, and there is also hemoglobin electrophoresis. Also in microbiology there is gene sustain, there is I have not much great experience in microbiology laboratory, but there is the routine culture and routine stain that we can do in the microbiology laboratory. And he may ask you about what do you do in your previous employment or background about your previous experience. So you can say to him, I have a strong background in biochemistry laboratory as well as hematology laboratory. As an example, I have worked in many different laboratories with different setup, and in hematology I have done an experience in like automation machine as well as coagulation. Also you may say I have an experience in morphology, in differential count, or whatever you are professional in. Okay, now I can introduce question, as I said, randomly. Okay, there is a question about accreditation. The employer or lab supervisor may ask you about accreditation. What is accreditation? What do you know about accreditation? So you can say accreditation is a recognition or certificate that is being given to an institute or to even somebody after meeting certain standards or certain criteria. After inspection, the most important step is inspection. If we comply with their guidelines and standards, then they grant us the certificate or recognition that we are meeting a standard. And as example, we can accredit it by JSI or CAP. JSI is abbreviation for Joint Commission Internal and its accreditation for hospitals, and CAB is abbreviation for College of American Pathology and its accreditation for laboratories. Okay, and also there is an important question about critical result. There are 3 questions about critical result. Number 1, what is the critical result? What is the policies for the critical result? And what is readback policy for the critical result? Okay, number 1, what is critical result? The critical result is any extremely abnormal high or low values or parameters that may have direct impact on patient outcome, like death. It is seriously bad on patient outcome. Like as example, glucose over than 600 or glucose less than 60 or 50. This is critical result. So what is the policies for it? Any critical result should be notified for physician, doctor or givers within 30 minutes. The most important information is within 30 minutes. We have to notify the caregivers that this patient have a critical result. So we have to pick a call and we have to notify him with patient which have a critical result with 2 patient identifiers. Like what? Like patient name or patient health card number or patient location, in which ward or in which department, and then tell him about the critical result. This is the policy for the critical result. And then number 3, the readback policy for the critical result. After we call the physician and tell him about the patient information and the critical result, so we have to ask the doctor, would you read back the results for me? So the doctor have to repeat all information that you give it to him. Okay, this is for effective and proper communication. And then you have to ask him about his name and his ID, and you have to record all of this documentation. Okay, examples of critical result: for sodium, more than 144, less than 118. For potassium, more than 6, lower than 2.8. For glucose, more than 400, lower than 60. For troponin, there is no critical result, only there is cutoff value. It is 0.01. For hemoglobin, over than 20 gram per deciliter or less than 4 gram per deciliter. For APTT, over than 100 seconds, and for PT is less than 40 seconds. For platelets count, less than 50 and over than 900. This is an examples for the critical results. Also, there is a question about biochemistry laboratory day-to-day practices. What to do daily in the biochemistry laboratory? You can say every day on daily basis we are doing instrument maintenance. The first step in the laboratory in the morning is instrument maintenance. The maintenance can be daily, weekly, bi-weekly or monthly, as directed by the manufacturer. The daily maintenance can be done by flushing, recycling of cleaning solution into the instrument so it can remove the protein debris. And then we have to run our quality controls as part of our daily internal quality control. If the quality control results are acceptable, Then we have to continue running the patient samples and we can report the patient results. Meanwhile, if there is any problem with our instrument, so we can use the backup machine. For each department, there must be a backup machine to avoid delay in patient results and to maintain our TAT, the turnaround time. I will talk later about turnaround time. If the results of quality control are not acceptable or out of range or exceed their mean by 2 standard deviation, or there is one with God rules is violated, or these have the same meaning, then there is a corrective action that I have to follow. They may ask you about what is corrective action. So, if the quality control result are out of range, so I have to make 4 steps. Number 1, rerun the control one more time. Okay, if the problem is solved, okay, I have to document what happened and continue my daily work. And if the problem persists, so I have to check the quality control lot number, if it is changed or not, and the expiration date. Also, if the problem is solved, okay, I have to continue. If the problem is still existing, so I have to check the reagent. Number 2. Number 1, check the quality control, run it more one time and check lot number and expiration date. This is number 1. Number 2, check the reagent, change reagent and open new vial of quality control material and run them together. If the problem is solved, okay, I have to document what happened and continue my daily work. Or if the problem is still existing, so I have to do step number 3, which is calibration for instrument. So I have to calibrate my instrument and run the control materials once again. Okay, if the problem is solved, I have to continue my daily work, and if the problem is still existing, I have to do the step number 4, which is contact engineer or manufacturer. And I have to document each step. Each step I have done, I have to document it. This is called corrective action for quality control material which are out of range. Also, there is a question about corrective WBCs count or incorrect WBCs count. When there is a nucleated RBCs in the peripheral blood, so the analyzer can count it as WBCs. So I have to make the corrective WBCs count. I have to make blood film, blood smear, then stain it, and then view it under microscope. And I have to count 100 WBCs. And during counting of these 100 WBCs, I have to count how much RBCs, nucleated RBCs are found there. Okay, again, I have to count 100 WBCs and the corresponding number of existing of nucleated RBCs. Okay, there is a formula for this correction. It is uncorrected WBCs multiplied by 100, all of this over nucleated RBCs plus 100. Okay, again, uncorrected WBCs multiplied by 100, all of this over nucleated RBCs plus 100. So by this way I can make correction for WBCs. They may also ask me about external quality control. What is external quality control? We can say also proficiency testing. It can also call proficiency testing or PT, and it evaluates laboratory testing results by comparing them to those similar laboratories. So there must be reference laboratory which send a specimen to all around similar laboratories around it. So that laboratories must analyze this specimen and send back the result within certain deadline time. And external quality control, it detects long-term accuracy and it provides us with peer comparison. That means it compare between us and all other laboratories, and it must run 3 times per year, and if the results are acceptable, it's okay, and if it is unacceptable, there must be troubleshooting steps and replay back to the reference laboratories and to ask them about what to do or how to solve the problem. And there is also further questions about quality control. They may ask you about what is quality control and why we do our quality control in our laboratory. We can say to detect, reduce, and correct errors in analytical process prior to release of our report. So by that way, we can make sure that our result is 100 or not 100%, it may be less, and it is accurate. And how many times quality control must be run? There may be single run per patch or per day, and the levels for the quality control may be low, normal, or high. Also, they may ask you about levogenic chart. What is levogenic chart? I have asked about levogenic chart in 2 different interviews, and you can say levogenic chart is a graph that quality control data is plotted on to give visual inspection whether the laboratory test is working well or not. Okay, it is graph, and from it I can know my performance. Okay, and they may ask you about also WizGuard rules. What is WizGuard rules for quality control? It is a set of rules used for laboratory quality control, and it is developed by James WizGuard. It is more than or about 12 rules. There is 1-2S. This is the first rule, and all WizGuard rules, it is about rejection of the result. If there is any violation of all WizGuard rules, you have to reject the result, except for 1-2S rule. It is called the Welding Rule. If 1S is violated or occurred in your routine quality control testing, you can reporting the patient result, but you have to trigger careful inspection of your quality control data, and you have to make the corrective action what I previously told you about, and you have to follow it. This is 1-2S. What does it mean? It's mean there is one of our control exceeds the mean by plus or minus 2 standard deviation. And there is 3-1S, that's mean 3 consecutive controls exceeds the mean by plus or minus 1 standard deviation. So we have to reject the result and make the corrective action. The 2-2S rule is 2 executive controls exceeds the same mean by 2 standard deviation. We have also to reject and make corrective action. And there is R4S rule. One control exceeds the mean by plus 2 standard deviation, and other control exceeds the mean by minus 2 standard deviation. Also reject and make corrective action. There is 4-1S. 4 consecutive controls exceed the same mean either by plus or minus 1 standard deviation. There is also 10x, 6x, 8x, 9x, and 12x. All of these exceed all these consecutive controls fall in one side of the mean, either up or down. There is 2 of 3 2S. That's mean 2 out of 3 controls exceed the mean by plus or minus 2 standard deviation. Also, there is 7T rule, which means 7 control trend in the same direction, may be higher or lower. If one of all these rules violated or occurred, I have to reject our quality control results and make corrective action. As I said, there is one exception, 1-2S, it's called the Welding Rule, so I have to make an inspection. They may also ask you about tumor marker. What is tumor marker and examples of tumor marker? You can say it is biomarker in the blood, urine, or tissue, and can be evaluated by presence of one or more type of cancer. Example, alpha-fetoprotein in the liver disease, CA 15.3 in the breast cancer, CA 19.9 in the pancreatic cancer, CA 125 ovarian cancer, PSA in the prostate cancer or prostate inflammation, CAA in the GIT disease or GIT. Assalamu alaikum rahmatullah. Here Iman Majid. I am medical laboratory technologist, biochemistry. I hold MTASCP, HAD and DHA, also master degree. My email is imanof@hotmail.com, EIMANOFE@hotmail.com, and I am a job seeker. Today I will talk you about the most important question that you may be asked about when you go to an interview for those who are laboratory professionals. So I will introduce the question randomly so you can organize it into your own organization. The first important common question in the interviews is introduce yourself. All the interviews in the hospitals and medical centers and the big laboratories are directed by laboratory supervisor. So the laboratory supervisor may introduce himself and ask you to introduce yourself too. So you can introduce yourself by your name and your professional title and your experience and now what you are doing. Okay, for me I can say I am Iman Majid and I am medical laboratory technologist, specialty biochemistry,